The last study we did was a study of a little bit more than 150 patients where we looked at the RDQ as a measure of change. And we found that the RDQ was sensitive to change and all the subscales on the RDQ were sensitive to change insofar as patients' scores at 3 months after initiating treatment was significantly lower than their baseline scores. The effect size was large for the overall scale, and it was equal in magnitude to the Hamilton Depression Rating Scale and the QIDS. We replicated our prior finding that the RDQ was significantly associated with self-reported remission status after controlling for the QIDS, but the reverse was not true. The QIDS was not associated with patients' self-report of remission after controlling for the RDQ. So our conclusion from these series of studies is that patients define remission much more broadly than it has thus far been defined in the literature. Increasingly in recent years, treatment studies of depression have not been limited to just evaluating symptom status, but they've also been looking at other factors such as psychosocial functioning. But this is only beginning to trickle in, and I think the future will be that looking at outcome in treating depressed patients will be broader than just symptom status. Where do we go from here? Well, one of the next most important studies to do is to look and examine whether or not a broad-based measure such as the RDQ can better identify which patients are at increased risk for relapse. So that if you take a group of individuals who have responded to treatment and then you examine the association between RDQ scores and subscale scores with follow-up status, our hypothesis is by capturing a broader array of constructs that the RDQ will better predict relapse status than a purely symptom-based measure such as the Hamilton or the QIDS. The RDQ, first I should note that the study was funded by Eli Lilly. However, the scale is available by contacting me. My email address is mzimmerman@lifespan.org. If you contact me, I'd be happy to send you a copy of the scale.